What I'm about to tell you could completely change the way you look at the 2 blood pressure pills sitting in your organizer right now. Because if you are over 60 and taking amlodipine and losartan together, there is something you need to understand immediately. This combination is prescribed every day. For many people, it works well. It lowers blood pressure. It reduces strain on the heart. It can be an important part of staying protected as you get older. But when problems begin, they often do not feel like medication problems. They feel like aging. They feel like weaker legs. They feel like poor balance. They feel like swollen ankles. They feel like fatigue. They feel like a heart that suddenly seems louder than it used to be. And that is exactly why so many seniors miss the warning signs until the situation becomes much more serious than it needed to be. Now listen carefully, because this part matters. This is not a message to stop your medicine on your own. Never do that. Not with blood pressure medication. If Dr. Clara Hoffman prescribed amlodipine and losartan together, there may be a very good reason. Amlodipine relaxes blood vessels through one pathway. Losartan lowers pressure through another. Together, they can be effective. But effective does not mean harmless, especially after 60, because after 60, the body is less forgiving. Kidneys may be more sensitive. Fluid balance may change faster. One day of poor appetite, diarrhea, sweating, heat, or dehydration can make the exact same dose feel very different from the week before. And here is what worries me most. Many seniors do not get into trouble because they took the wrong medicine. They get into trouble because they kept taking the right medicine while ignoring what their body was trying to say. A little swelling becomes severe by evening. A little dizziness becomes a fall in the bathroom. A little weakness becomes an emergency visit. A quiet lab abnormality becomes a heart rhythm problem nobody saw coming. By the end of this video, you are going to understand the 7 most important warning signs this combination can create after 60, why they happen, which one is the quietest but most dangerous, and what symptoms should never be dismissed as just getting older. But before I show you side effect number 7, you need to understand something that changes everything. Amlodipine and losartan usually do not cause trouble in one dramatic moment. They cause trouble slowly, subtly, almost politely. Amlodipine relaxes blood vessels very effectively. That can lower blood pressure, but it can also lead to swelling, flushing, fatigue, and a sensation that the heartbeat is more noticeable. Losartan works differently. It blocks the effect of angiotensin II, which helps blood vessels stay more relaxed and pressure stay lower. But it also affects how the body handles fluid balance, kidney blood flow, and potassium. Put those together and yes, blood pressure may improve. But in some seniors, the side effects also combine in a way that creates instability. Not always dramatic instability. Sometimes it is just enough to make you feel weaker, slower, less steady, less confident, and strangely unlike yourself. So let's begin with side effect number 7. Side effect number 7 is swelling in the ankles, feet, and lower legs. Not just minor puffiness, I mean that end-of-day heaviness where your socks leave deep marks, your shoes feel tighter at night, and your legs suddenly look fuller and more tired than they did a few weeks ago. This is usually driven more by amlodipine. It relaxes the arteries well, but the return of fluid through the veins does not always keep pace, so fluid shifts into the surrounding tissues. And what makes this symptom dangerous is not just the swelling itself. It is the decision many seniors make next. They start skipping doses. Not every day, just here and there. Travel days, family events, church mornings, days when they know they will be on their feet. That choice feels logical. If the medicine seems to be causing the swelling, then less medicine must mean less swelling. But while the swelling may seem better, blood pressure can start rising again quietly in the background. That is the trap. Swelling does not always mean the medicine is damaging the heart. Often it means the medicine is doing what this class of drug commonly does. The answer may be dose adjustment. It may be timing. It may be a different plan from Dr. Clara Hoffman. But the dangerous move is silence. If swelling is new, worsening, or accompanied by shortness of breath, chest pressure, or rapid weight gain, that is not something to hide. That is something to report to Dr. Clara Hoffman promptly. Now, side effect number 6 is the one that makes seniors lose trust in their balance. It is dizziness and lightheadedness. And I want to be precise. I am not talking about a vague off day. I am talking about that floating feeling when you stand up. the brief loss of confidence, the hand reaching for the wall, the extra pause before taking the first few steps. Both medicines can contribute to this. Amlodipine relaxes blood vessels. Losartan lowers pressure through a different system. In a younger body, that may be easy to tolerate. In an older body, especially one already dealing with balance issues, neuropathy, dehydration, or heat, standing up can suddenly become a much bigger event than it used to be. The symptom may last only seconds, but the consequences of those seconds can be enormous. One unstable step, one missed grip, one fall, one fracture, one head injury, one life that changes in a single morning. And what makes this especially deceptive is inconsistency. It may not happen every day. It may happen after a hot shower, after a missed meal, after poor sleep, after a warm afternoon, after not drinking enough water, after another medication was added. That inconsistency confuses people. They think, if it were really the medicine, it would happen all the time. Not true. In older adults, side effects often depend on the condition of the body on that day. That is why this symptom gets dismissed far too easily. If standing up suddenly feels harder than it used to, that matters. If the room does not spin but your body still feels briefly unsafe, that matters. And if this starts after being on this combination, Dr. Clara Hoffman needs to know. Now, side effect number 5 is the one families often notice before the patient admits it. Unusual fatigue, body heaviness, or daytime sleepiness, not normal tiredness. I mean the kind of drained feeling where simple things start costing too much energy. Walking to the kitchen feels like effort. Afternoon drowsiness becomes a pattern. Motivation drops. Even conversation can feel more work than it should. Amlodipine can cause fatigue or sleepiness in some people. Losartan can also contribute to fatigue, especially if blood pressure is running lower than the body likes, or if fluid balance is off. This is one of the most misread side effects in senior medicine, because fatigue can be blamed on almost anything: age, weather, poor sleep, stress, grief, lack of exercise, a slow day, a bad week. And sometimes those explanations are true. But if the fatigue began after starting the combination, after increasing a dose, or after adding another medicine, then it deserves attention. Because the body often whispers before it screams. And when seniors ignore that whisper, they often compensate in ways that make everything worse. They move less, they walk less, they drink less, they stay seated longer, they lose strength quietly. Then, weeks later, everyone says the same thing. I guess this is just part of getting older. Maybe it is not. Maybe it is a body that has been overtreated, underhydrated, or poorly matched to the current dose. Controlled blood pressure on paper is not the only goal. The goal is to protect life without flattening it. If this combination leaves you feeling dulled, slowed, or unlike yourself, Dr. Clara Hoffman should hear that clearly. Now, side effect number 4 is the one that frightens people, because it feels like the heart itself is objecting. Palpitations, a pounding heartbeat, a racing heartbeat, a heartbeat that suddenly feels too noticeable. Amlodipine is known to cause palpitations in some people. And losartan warnings also include the possibility of fast or irregular heartbeat in some situations, especially if blood pressure, fluid balance, or electrolytes are no longer where they should be. This is how it often feels. You are lying in bed, the room is quiet, and suddenly your heart feels louder than normal. Not always painful, not always fast enough to count, just different, forceful, strange, impossible to ignore. Then the mind starts racing. Is this anxiety? Is this a rhythm problem? Is this dangerous? Is something seriously wrong tonight? Sometimes it passes quickly. Sometimes it returns night after night. Sometimes it appears after heat, dehydration, exertion, illness, or a medication change. The problem here is not only the symptom, it is the uncertainty. Uncertainty makes people do risky things. They hide it, they wait, they obsess over home readings, they tell themselves they are overreacting, they decide to watch it for a few more days. That can be a mistake. A brief palpitation is not automatically an emergency, but palpitations with dizziness, chest discomfort, weakness, shortness of breath, or near fainting should never be brushed aside. In older adults, the first warning of a deeper problem is often not dramatic pain. It is simply the sense that the heart no longer feels normal. If your heart suddenly feels noisy, jumpy, pounding, or irregular while on this combination, Dr. Clara Hoffman needs to know. Now we move to side effect number 3. This is where the situation becomes more dangerous. Fainting, near fainting, or blood pressure dropping too low. Not just mild dizziness. I mean that cold, hollow wave where vision dims, the knees soften, and your body tells you very clearly that if you do not sit down now, you may go down. This can happen with blood pressure medicine in general, but the combination of amlodipine and losartan deserves special respect after 60 because two different mechanisms are working to lower pressure at the same time. That can be excellent when the body is stable. It can be dangerous when the body is not. This is the side effect that often appears during completely ordinary life. Standing after lunch, getting out of bed too quickly, taking a hot shower, walking outside in summer heat, climbing stairs after drinking too little, taking your pills during a stomach bug because you never miss a dose. That last one sounds disciplined, but during illness, discipline without guidance can become danger. Many seniors are taught to fear only high blood pressure numbers. High blood pressure is the enemy everyone recognizes, but pressure that falls too low, too fast, or at the wrong moment can be just as destructive because it causes falls, confusion, weakness, poor organ perfusion, loss of confidence, loss of independence. And here is the cruel part. A person may look at the home monitor and say, "My blood pressure is finally better." Meanwhile, the body is saying something completely different. If you develop near fainting, sudden weakness, or repeated episodes of feeling like you may collapse, especially during heat, dehydration, vomiting, diarrhea, or poor intake, do not just push through it. That is the moment to call Dr. Clara Hoffman. Now, side effect number 2 is the one many people never feel clearly until blood work or illness exposes it. Kidney stress or worsening kidney function. This is where losartan deserves real respect. Losartan is not a bad drug. It is a powerful drug acting on a powerful system. And the kidneys are extremely sensitive to changes in blood flow, pressure, fluid balance, and dehydration. Here is why seniors miss this. Kidneys do not always complain dramatically. They do not usually hurt the way a knee hurts. They do not shout the way chest pain shouts. They simply work less well. Maybe you feel more tired. Maybe appetite drops. Maybe swelling worsens. Maybe urination changes. Maybe blood work later shows a problem nobody saw coming. And the risk gets worse when 3 things collide. Losartan, dehydration, pain relievers like ibuprofen or naproxen. That combination matters because many seniors do not think of over-the-counter pain medicine as part of the blood pressure story. They think it is just for the back, just for the knee, just for the shoulder. But the kidneys do not care why you took it. If kidney reserve is already lower with age, then one short illness, one hot week, one poor appetite, one stretch of diarrhea, or one habit of taking NSAIDs can narrow the safety margin quickly. That is how a stable medication routine can suddenly become unsafe. Not because the medicine changed, because the body changed. If you are sick, not eating, vomiting, having diarrhea, sweating heavily, or relying on ibuprofen or naproxen while taking this combination, do not assume the usual routine is automatically safe. This is exactly the kind of situation that should be discussed with Dr. Clara Hoffman. And now we come to side effect number 1. This is the quietest risk on the list, and in some ways, the most dangerous: high potassium. Because potassium is not just a number on a lab report, potassium helps control the electrical rhythm of the heart. Losartan can raise potassium in some people. Not everyone, not every time, but enough that it must be respected, especially in older adults and especially when kidney function is not perfect. What makes this risk so dangerous is that it can be silent. A little weakness, a few muscle cramps, a strange sense of heaviness in the legs, an occasional skipped beat, or nothing obvious at all. That is what makes it different. Swelling announces itself. Dizziness announces itself. Fatigue at least has a feeling. High potassium can hide. And the tragedy is that many people accidentally make it worse while trying to be healthy. They switch to salt substitutes. They add potassium products. They drink electrolyte mixes. They start meal replacements. They use heart-healthy products without checking what is inside them. And all the while, losartan may already be pushing potassium upward in the background. That is not carelessness. That is incomplete information. And incomplete information is dangerous after 60, because older adults often have less room for error. If potassium rises too high, it can affect the heart's rhythm in a serious way. That is why this side effect earns the top spot. Not because every person will feel it, because it is one of the easiest serious problems to walk into quietly. So what should you do if you are over 60 and taking amlodipine and losartan together? First, do not stop the medicine on your own. Second, stop taking it casually. Do not take it blindly. Do not ignore new symptoms. Do not assume every change is just aging. Third, learn your baseline. If your shoes suddenly fit differently, if standing feels harder, if your heart feels more noticeable, if your energy crashes, if your legs feel weak, if illness changes how you feel, that information matters. Fourth, speak with Dr. Clara Hoffman before using potassium supplements, salt substitutes, electrolyte products, or regular NSAID pain relievers like ibuprofen or naproxen. Fifth, respect dehydration. Vomiting, diarrhea, heavy sweating, poor intake, fever, and heat can change how safely this combination behaves in your body. Sixth, get the blood work Dr. Clara Hoffman recommends. Kidney function and potassium are not minor details. They are part of safe treatment. And seventh, respect symptoms even when the blood pressure number looks good. A good reading does not overrule a body that feels unstable. Let me bring the 7 warning signs together clearly. Number 7, swelling in the ankles, feet, or legs. Number 6, dizziness and lightheadedness. Number 5, unusual fatigue, sleepiness, or body heaviness. Number 4, pounding, racing, or irregular heartbeats. Number 3, fainting, near fainting, or pressure dropping too low. Number 2, kidney stress, especially during dehydration or NSAID use. And number 1, high potassium, the silent risk that can disturb the heart's rhythm before you fully realize what is happening. If you remember only one thing from this video, remember this. The side effects that do the most damage in seniors are often the ones first mistaken for normal aging. That is the real danger, not just the medicine, the misreading of the medicine. Blood pressure treatment is supposed to protect life, not quietly shrink it. Not leave a senior weaker, more fearful, more unstable, more dehydrated, or less able to enjoy the years treatment is meant to preserve. So if you or someone you love is taking amlodipine and losartan after 60, do not panic. Do not self-diagnose. And do not throw the pills away in fear. That would be the wrong lesson. The right lesson is this: pay attention sooner. Ask better questions. Respect quiet changes. Know that aging and side effects can look dangerously similar, and talk to Dr. Clara Hoffman before making any medication change. Because sometimes the body is not failing, sometimes it is warning you. And the people who stay safest are usually not the ones who ignore those warnings. They are the ones who recognize them in time. If you want, I can now do either of these next.